Our digital library will build to create better information sources for their users or patients by providing various information regarding healthcare, such as dietary, types of disease, how to prevent and cure disease, and also provide advice services from our doctors and advisors through online. The missions of our library is to let people all of age have unrestricted and open access to the wide variety of resources services that are made available for our digital library. The visions of our library is to achieve corporate greatness via close cooperation with the organizations that serve our community. There are three objectives of our digital library, which are: first, to document and archive an internal part of the medical health; second, to promote the contextual and historical of the digitization library; and last, to ensure that people can receive health care. This is our digital library organizational chart.
Significant to individual. For the first is can find the information about chronic disease. Second, this project data library give more knowledge about chronic disease. Third, educate younger generation about the chronic disease. Second, significance to the organization. For the first is the organization to collect the materials that related with the chronic disease. Second, unrestricted access to wide range of resources to the organization. And third, help the organization to share the information about chronic disease to the staff and patient. Lastly is significance to community. First, community can get more knowledge about the chronic disease at their fingertips. Second, serve as a repository for vital research data, information and conclusion. Third, community can expand their knowledge about chronic disease. And fourth, community can save the budget or money.
Handling the materials. Firstly, for the books, always keep your hand clean and dry. The material should be placed on a clear surface. For the newspaper, use a thick support paper underneath the item or place the item within a folder. For the photograph, always try to avoid touching the actual image on a photograph. When it is not possible to do so, handle the photograph by its edge or the material that it is housed in. For the article needs to be shielded from the elements including the sun, the heat, the damp, the precipitation, the dust, the animal, and the insects. For the magazine, insert acid-free tissue paper in the spaces between the pages that you want to keep. Format of digitized. For the book is TEI, that is the Tag Encoding Initiative. For the newspaper is PDF. For the photograph is JPEG or JPG. For the article is PDF, and for the magazine is TEI. Type of collections including the books, newspaper, photograph, article, and the magazine.
The third one is material selection. It is to satisfy the user demands or requests. So the libraries frequently digitize the priority resources that most urgently required. Last but not least, utilizing annotated equipment, which is to simpler the handling process is when using automatic equipment. On the top, which is known as the director. Under the director, there are 5 sections, which is the administration, public relations, IT services, collection services, circulation services, and under the administration had a maintenance. Every position, every department had their own roles or own responsibilities. For the director is to establish and develop the goals, rules, and the target. for the administration is to control and manage the director goals and regulations, as well as the library's operational activities. For the maintenance is to ensure the infrastructure is in a good working order. For public relations is plus the public with information about the upcoming activities or the event by using the social media. IT services is to control the network and system of the library computers and also maintaining all other electronic parts. The collection services is to assign a serial number or the barcode for the digital materials. And the circulation services is to manage and control the process of loaning out and collecting return item to keeping track of the funds incurred by user for late return or lost or damaged resource material.
This is the organizational structure for this project, which consists of project leader Nur Aina Syairah binti Azlan, system analyst Nur Maisarah binti Ibrahim, web developer Nur Hanakiyah binti Idlan, marketing project manager Farid Nur bin Osman, information material specialist Nur Alia binti Ahmad. Responsibility of project leader is develop team schedules and assist in successful onboarding and training of team members, while responsibility of system analyst is supports, troubleshoots, and upgrades the applicable system infrastructures for this project. Responsibility of web developer need to know about HTML, CSS, JavaScript, PHP, and other relevant web design coding languages. Next is information material specialist responsibility is researching new and existing materials and also assessing their suitability. And for the last is responsibility of marketing project manager, which is collaborate with web developer which responsible for design the website for this project.
There are 6 infrastructure and equipment that used in this project. First, desktop computer and laptop. Desktop computer and laptop will be required for the staff in handling task-related chronic disease collection, such as the staff managing the library content. Second, digitalization device. In converting the documents such as image or piece of paper, we need to use the scanner in scan the document to become in digital format and will transfer to computer device. There are 2 types of scanner that has been used in this digitalization project, which is a sheet feed scanner and flyback scanner. Third, we use storage device. The Ace Medical Centre E-Library require hard storage space with multiple hard disks, so in the library we have backup and storage server. Next infrastructure is networking and location of digital library server computer. There are several options for providing online access to the digital library collection via the internet. In the Ace Medical Centre E-Library collections, we already have the required network infrastructure, which are intranet and internet connectivity such as TMNet streams. Next, library management system. User may search or retrieve the information stored on the digital library server, that is via document or electronic information. We use library catalog as in a physical library to search and get good efficiently. The last one is software requirement. Other software requirements that are used in Ace Medical Centre E-Library include digitalization software like Adobe Acrobat and Cam Scanner. The last one is for the budget. Our team is really detailed in the calculation of our budget for this project. Any cost that involved in the project will be listed on the list of budgets. Hence, the budget planning is important for the project because it will make the project flow running smoothly without any difficulty in affording the unique item or software for the project. This is necessary equipment along with the budget that has been invested for this project.
This is the equipment budget for this project. The total is RM2,277. The budget for software and hardware that used in this project is RM69,762.